Now to an exclusive story you'll only see on 4 News Now. With things sort of returning to normal, it's easy to forget that we're still in the middle of a pandemic.
We know the real key to getting back to where we left off is getting enough people vaccinated. And if you're someone who's on the fence, these stories from an intensive care doctor may change your mind. Katerina Chryssafis explains in this exclusive story.
COVID-19 has touched all of us in one way or another, but for the ICU doctor I spoke with today, it's changed his life in more ways than he could have ever imagined.
I don't think any of us are going to walk out the other side the same person as we were in 2019.
Since the start of this pandemic, more than 5,000 people in Washington have died from COVID-19. But it's the stories behind those numbers that stick in Dr. Benjamin Arthur's mind.
That's only a scratch of the surface of what patients and families have gone through.
Dr. Arthur's works in the intensive care unit at Multicare Valley Hospital.
I've been a doctor since 2012, almost a decade now.
Never in his almost 10 years of working in medicine has he ever experienced anything quite like this.
We see people with multiple medical problems and in their 70s and 80s who come into our ICU for lots of reasons, but we saw people on death's doorstep who were in their 40s and 50s last summer.
Young adults with no underlying illnesses now fighting to stay alive.
And those were the first moments where it was a gut check, because that's not far away from me in terms of age, and I could picture all the people around me, my family, and you know, being in that same circumstance. And
it wasn't long before picturing it became a reality when one of his colleagues, an ICU nurse, landed in the intensive care unit herself.
That was incredibly emotional for everybody in our hospital to see, and it just hits really close to home.
That nurse luckily survived, but Dr. Arthur says that wasn't always the case.
As an ICU doctor, one of the things I do in my career is I see people in their last moments.
A moment typically spent surrounded by loved ones, now replaced by phone screens and virtual goodbyes.
We've just never had anything like this in medicine where we haven't had those precious moments with people at bedside, and that has been agonizing for our staff to deal with.
To some, 5,000 may just seem like a number, but for Dr. Arthur's, it's a reminder of just how truly precious life is. In Spokane, Katerina Chryssafis, 4 News Now.